people a few minutes to hop on here. Maybe not a few minutes. Hello, everybody. Welcome, welcome, welcome. All right, let's get started, shall we? Well, hello, everybody. My name is Meredith O'Connor. I serve as Assistant Vice President of Patient Engagement, Advocacy, and Policy here at the MGFA. Thank you so much for tuning into today's wellness webinar, which we are focusing on the importance of caregiver self-recognition in honor of Family Caregiver Awareness Month. So today we have the pleasure of having one of our alliance partners join us to speak on this topic, specifically Nichole Goble, who is the Director of Community Initiatives at Caregiver Action Network. And Nichole today has stated, as many caregivers, especially when starting their caregiver journey, have difficulty identifying as a caregiver. So today, this webinar will touch specifically on why some struggle with that title, and then why it's important to quote unquote claim that name, right? Particularly in certain circumstances and settings. So before we do that, I want to thank our sponsors. Our national presenting sponsors, Alexion, Argenx, and Johnson & Johnson, national collaborators, Amgen, and our national sponsors, UCB, Roche, and Andy Serrano. So I'm going to go ahead. Oh, before I do that, I did want to make note that if you are tuning in and English is not your first language, you can simply click the show captions at the bottom of your screen and click the appropriate language that works for you. Okay, so I'm going to stop sharing my screen. And Nichole, do you have the ability to share your screen? Oh, first you're on mute. Sorry, Nichole.
No problem. It says that I need permission.
Oh, let me give you that. Hold on. Okay. Can you do that now?
I certainly can. Okay. So just give me 1 second and I will. Okay. So I'm really excited to be here and to be talking about the importance of caregiver self-identification. It's National Family Caregivers Month. I'm going to be talking a little bit about that towards the end. And self-identification is something that we've been really focused on here at Caregiver Action Network, but also something that's really a foundational piece of our NFC Month campaign. So really excited to kind of talk about this topic because I think it's really important. So yes, as Meredith said, my name is Nichole, and I am the Director of Community Initiatives here at Caregiver Action Network. So I get to do a lot of fun stuff like this, being able to present to amazing groups, share a little bit about the work that we're doing, and talk a little bit about some central issues and topics that are on caregivers' minds. And in addition to my role here at Caregiver Action Network, I'm also a caregiver. Not a surprise because there are over 100 million caregivers in the US. So it's, a lot of folks. But I'm a long distance caregiver for my mom who has COPD and lung cancer. And so this work is really personal to me, but certainly, lots of my colleagues here at Caregiver Action Network also come to work with their own caregiving experience and stories too. So this is something that is really meaningful. All right, so let's just jump right into it. And what does caregiver self-identification mean? So one of the things I think is important to underscore here is that more than half of that 100 million plus, or I would say some of that, But also, people who aren't identifying, so people outside of that number, more than half, uh, don't recognize themselves as a caregiver. And one of the issues with that is that means that they're not assessing or accessing a lot of the crucial resources and supports that are there for family caregivers. So that's really what we're talking about in terms of self-recognition. So self-recognition, I kind of put it into two different pots. One is about claiming the name of caregiver. And so I'll talk a little bit about this more when I talk about what some of the challenges are when it comes to that self-identification piece. But a lot of caregivers don't claim the name of caregiver for many different reasons. But I would say one that comes up the most is that you know, folks feel that it kind of invalidates the broader relationship that they have with the person that they're caring for. I'm going to go a little bit deeper on that in just a bit, but that's one of the many reasons that self-recognition can really be a struggle for folks, and really that name. But outside of claiming the name of caregiver, it's also about claiming that role. Um, in addition to not necessarily wanting to call yourself a caregiver, many caregivers struggle with seeing that the support that they provide to their loved one is, in fact, kind of in that umbrella of caregiving. I think a lot of folks have some ideas of what caregiving consists of, and for lots of different reasons, and we'll talk about that here in a minute, they just don't see how the support that they're providing would necessarily fall into that category. And so, um, you know, there's that challenge in putting a voice to that support that they're providing to their loved one. All right, so let's talk about why is caregiver self-identification important. Well, one of the things that I talked about before is that obviously, if you're not referring to yourself as a caregiver, it's going to be a lot more challenging to find those supports and resources specifically for you as a caregiver. So I think, it's important to kind of keep that in mind as we're going through some of these things. But the decrease of caregiver loneliness and isolation. Now, you may think that with there being over 100 million family caregivers in the US, how can one be lonely? How can we feel isolated in that role? But it is common. A lot of people feel like they get absorbed into their role as a caregiver, and they start to maybe cut off from different social outlets that they had, or they're dealing with things that they don't feel that they have a support network that they can turn to. And so it's important that when you start to self-identify, you can then feel a little bit more comfortable and connected to that community of other caregivers. You can start joining support groups, even just sharing. One of the things that we do a lot of work with employed caregivers. So caregivers that are balancing work and caregiving, and a lot of them will say, it was really awkward for me to talk about being a caregiver while I was in the workplace, but once I did, I found out that the person next to me in the little computer cubicle is also a caregiver. And so it being able to kind of claim that name and claim that role helps decrease that loneliness and isolation. It kind of on the same thread, it normalizes caregiving. So over 40% of adults in the US are family caregivers. So again, if we're not necessarily claiming that name and claiming that role, talking about caregiving, it's still something that is kind of creating that isolation. And so by claiming that name, claiming that role, we're normalizing it. We're kind of standing up and being represented within that caregiver population. And of course, it opens up the door to resources specifically for you. So if you're not a caregiver, would you know to look up Caregiver Action Network for supports? I don't know. So again, this is why the name and the role, claiming both of those is really, really, really important. And so let's talk a little bit now about where is caregiver self-identification very crucial. So I think one that probably seems pretty straightforward is your loved one's healthcare providers, their healthcare team, letting them know that you are uh, a caregiver. Explain a little bit about maybe the role that you provide, the support that you provide to your loved one. This team can include the doctors, including those nurses, physicians assistants, specialist technicians, mental health professionals, specialists. So the whole kind of smorgasbord of healthcare professionals. Why would it be important for your loved one's healthcare team to uh, know about your role as a caregiver? Because that's going to be very, very, very informative and a key piece to how you're designing that care plan for your loved one. You know, no one is with their loved one probably more than their caregiver. You're with your loved one at home. You have a sense of what their day-to-day is like. And so as you're talking through treatment, therapy options, management of symptoms, all of these things, you are a vital piece of information. And caregivers are often really key in executing, helping execute and keep that care plan on track. If part of your loved one's care plan is, you have to take this medication every day and they have problems with that, so they need you to provide that reminder right there. You're speaking to being that really vital piece of that care plan. And this is why it's really important to let your loved one's healthcare team know. Let the emergency room healthcare team know you're a caregiver. When you are caring for a loved one with some health issues, a trip to the ER, not outside of the realm of possibility. And in some cases, it can be something that happens a little bit more regularly than we would like. And so again, kind of the same idea within the context of the other healthcare team. Letting them know that you are the caregiver helps them, know that you're a source of information that they can come to ask questions. Also, that gives them a sense of the kind of role that you would play once your loved one is able to go home. So really two crucial pieces there. Let your healthcare team know you're a caregiver. It cannot be stated enough that caregiving takes a mental and physical toll on caregivers. So letting your healthcare professional team know about your role as a caregiver, again, it's giving them a more holistic picture of who you are as their patient. And so again, that can be really informative. If you come in and let's say that you have, I don't know, let's say that you're experiencing a lot of lower back pain and something that's been frequent. Well, if you're a caregiver, and let's say that you are caring for a loved one with mobility issues and you have to provide some assistance and help lift them or transfer them from like bed to maybe a wheelchair or something like that. any kind of like physical piece of that, well, that's going to be a piece of information that's going to be helpful to the healthcare team, your healthcare team, to say, okay, well, how do we address this? What could be the problem? So again, really important, just to kind of, let that healthcare team know about your role as a caregiver so that you're getting treated in a really holistic manner. Let your supervisor and work team know. So like I mentioned before, we've been doing a lot of work with various employers, helping them with employee resource groups. And, uh, being able to balance work and caregiving, it's hard, something that I'm sure we all can realize. And so what is something that can be an assist there? Well, if you are talking to your supervisor and your work team, you don't have to give lots of details. You don't have to come toting in your loved one's medical records, anything like that, for sure. But just giving them an idea of, hey, I'm a caregiver. I care for my mom. She has infusion appointments on these days, so I'm not going to be in until 10 o'clock. Putting that out there, I think, is important, because then they can be kind of part of that extended, what we call the care team, your care team, and your support. So, if something comes up and there's a meeting that you're not able to make, they have some understanding of what's going on and they can chip in. Again, it's all about kind of how we are able to share, where we can use some support, and letting people kind of give us an assist when they're able. So letting your supervisor and work team know is a great kind of way to make sure that you're getting that support at work. Additionally, there may be workplace benefits that they can point you in the direction of, flex time, paid time off, family leave, support groups. The offerings are going to vary a lot, but that's all really great stuff. And so if you say, hey, I happen to be a caregiver, when you're talking to your supervisor, they can say, oh, well, we have this whole kind of package here of things that you may be interested in. So let's talk about it. So really, really useful to share with your supervisor. And like I said, you don't have to share everything, just enough so that they have an understanding of kind of what your schedule and day-to-day can look like. And one that we don't often talk about is let your religious or spiritual leaders know you're a caregiver. Churches, places of faith and worship are really big places of support for caregivers. Just this past weekend, I went to a church in Baltimore that had a caregiving ministry. And they were having kind of like a resource fair, kind of in between their morning services. And it was really amazing. So, it's really about identifying where in the community you are seeking out and where you're going to be to find that support. And so letting your religious leaders know, many churches have support groups, caregiver specific programs, lots of things. And we're seeing it more and more. Caregiving ministries, health and wellness ministries, they're really wanting to make sure that caregivers in their congregations are feeling supported. And so, it's very useful to, speak to those religious or spiritual leaders. And again, there's going to be plenty of other caregivers in that congregation with you. It's also worth mentioning that a lot of folks who are who do find a lot of support within a faith community, they often look at their kind of faith community as extended family. And those can also be extended members of the care team, not just for yourself, but maybe folks from church are coming over and helping out with meals every so often, or there's someone at church that is helping take a loved one to and from a medical appointment that you're not able to do. So letting folks know, I think, is a good option here. So what are some of the challenges to identifying as a caregiver? We touched on a couple of these already, but we're going to go a little bit deeper. One is culture. Research suggests that cultural perspectives differ across various ethnic groups, and this can impact caregiving experiences in lots and lots of different ways. And so, especially, we're in the US, we are a melting pot. We have lots of different cultures represented. And so, understanding that, folks of certain communities with certain backgrounds, they may have a different approach or a different relationship to a caregiving dynamic. And so what does that mean, and how can we continue to make sure that they're connected and still kind of claiming that name and role in a way that's still respectful to kind of their cultural identity. Another challenge is that caregivers feel like the support or care that I'm providing doesn't necessarily feel like caregiving. When we think of caregiving in our minds, I think a lot of people see someone who has to give a pretty substantial amount of care and support to a loved one, someone who's maybe helping with all of those activities of daily living, lots of hands-on day-to-day care. But that doesn't necessarily, that's not necessarily true. Caregiving looks a million different ways. In fact, it probably looks over 100 million different ways. And, it's, identifying that, hey, going over and helping a parent out a couple times a week, do laundry because they have issues getting up and down stairs, or, things like that, that still falls under the umbrella of caregiving. So something to keep in mind. I mentioned this at the beginning as well, but feeling like the term caregiver minimizes their loved one's autonomy or independence. This kind of goes a little bit with minimizing, kind of the broader relationship. But, by calling yourself a caregiver, it feels like it's saying, well, my loved one isn't capable of doing X, Y, or Z, and it's diminishing their autonomy and things that they are able to do on their own. And that's not necessarily true. Again, calling yourself a caregiver is just identifying, like, I do provide a little bit of extra support here and there for my loved one. And it can be, there's that vast kind of array of what that can look like. So it's not necessarily cutting down or diminishing your loved one's autonomy or independence to say, hey, I'm the caregiver and I provide a little bit of assistance. We all need help from time to time. And then feeling like the term caregiver minimizes our the aspects of our relationships with our loved ones. So, I'm not a caregiver. I'm a mom. I'm a child. By claiming that name caregiver, some caregivers feel that suddenly that other relationship doesn't necessarily exist anymore, or it's really put off to the back burner. And that's not necessarily true either. It's just a little spoke of that relationship. So I think that's really important to note. You can still be mom, dad, kid, aunt, uncle, niece, nephew, a friend, neighbor, and still be a caregiver too. It doesn't take anything away from that relationship. All right, well, I want to get into some resources as we kind of get towards the end here. So first and foremost, I want to talk about our family caregiver toolbox. So for caregivers, we have the family caregiver toolbox, and it's really our hub of where all of our resources kind of live. It's really cool. We just had a redesign of our website a little bit earlier this year. And so you can come into our website and you can search by a few different categories. You can search by disease or condition because we've been really ramping up the resources, the disease and condition specific resources that we're creating. You can search and sort through, whether you are a new caregiver, you've been a caregiver for a while, you're a long distance caregiver, or you're a working caregiver. You can also sort, and I realize it has caregiving basics on here, but we have different categories. So caregiving basics, financial and legal support, things like that. These various different kind of topics within caregiving. And then we have the full search as well. One of our big resources too is our caregiver help desk, and it is kind of what it sounds like, a support line for family caregivers. The number is here on the screen. You can also go to our website, and on any of the pages that you navigate to, you're going to see a little orange box at the bottom of your screen that says help desk. So you can chat as well. There's also an email function if you go to our website. So there's lots of different ways to reach out to the help desk because I don't know about you, but sometimes I don't like to talk on the phone. It's much easier for me to chat or what have you. So we like to make it easy and accessible for all caregivers. Now, one thing I will point out is that this isn't a 24/7 support line. It's staffed from Monday through Friday, 8 a.m. to 7 p.m. Eastern. And I will say, though, that you can reach out anytime. So if you call and it's 2 a.m., you can leave a voicemail and I'll get back to you within the next business day or two. I work directly with the caregiver help desk staff, and they are really amazing about getting back to folks very, very, very quickly. And if you send a chat at 2 a.m., it's going to be sent as an email. So, you're not going to fall kind of in the cracks there if you reach out outside of those hours. Okay. So I want to kind of close things up by talking a little bit about National Family Caregivers Month because it's November. It's National Family Caregivers Month. Although a little bit of a secret, here at CAN, it's kind of always National Family Caregivers Month. But this is, a big month for us, and we're so excited, to be presenting here and sharing a little bit about what we're doing for National Family Caregivers Month. So one of the cool things about what we're able to do with NFC Month is we get to set the theme. And so this year's theme is I Care. So we really wanted to emphasize the ideas around self-identification and, the why and the how folks provide care to their loved one. And so we are, of course, doing this by telling caregiver stories. And so you'll see one here, how we've kind of laid it out. I've never had a great relationship with my dad, but since his Alzheimer's diagnosis, I'm all he has. He moved in with me and I provide around-the-clock care. And then you see here that I care out of obligation. So we really wanted to underscore just lots of different caregiver perspectives so that folks who, can see themselves in these stories. There's certainly a lot of caregivers who are caregivers by choice, who raise their hand and say, I absolutely want to take on this role for my loved one for any number of reasons. But there's also a number of folks who, feel that they had no choice in taking on that role. And so being able to shed a light on that, I think, is really important because it will help some folks see themselves there. And, again, going back to that isolation and loneliness, because that can feel very isolating. So another story here, I care while juggling work. So she has limited mobilities, and I'm able to go over and take some work calls from her house. So I'm able to be there and provide assistance. And so, probably something that lots of folks can relate to. I think, especially now that many of us have some capacity to work remotely or hybrid, where if we are caring for someone and we need to be over there, we can, kind of set up shop if we need to. And so, um, yeah, uh, I think a story that other people will find themselves kind of resonating with. So that's a little bit about what we're doing in terms of the storytelling with I Care. In addition to I Care, we are working with One Family Foundation. One Family Foundation was started by Bradley Cooper. He was a caregiver for his father who had cancer. And so they are kind of doing a side-by-side campaign called Care Out Loud. So we're really excited to have um, that partnership. And this we have laid out here a little bit about how we're engaging with lots of different partners for NFC month. So very exciting stuff. If you want to find out more just about NFC month in general, also read President Biden's presidential proclamation that came out, I think, on the 31st. You can go to the link here and learn a lot more. I think you also have access to like a social media toolkit if there's things that you want to share. So yeah, that's a little bit about NFC month. So I will put up here how to stay connected. Obviously, a lot of what we're doing with NFC month is online. It's on our socials. So all of our socials are here. I think it's a wonderful time to join. We're sharing lots of resources, sharing lots of stories. Very exciting. If you have any questions, you can always go to our website. I have the help desk number there as well. And then info@caregiveraction.org. Yes, it is an info address. I know that some people they're like, oh, but if I email that, will it just go into the void? I check that email address, so it will not. So feel free to reach out if you have any questions or if there's anything additional that you need.
Amazing. Thank you so much, Nichole. That was truly a wealth of knowledge and tips and great information for our caregivers. And I think you spoke to something that we don't always, it's sort of a niche topic, self-care identification, or excuse me, caregiver identification, and what that truly means. So thank you. If you have any questions, please feel free to utilize the chat. I was making notes during your presentation. I just had a couple of things that I thought were worth discussing, Nichole.
Sure.
One of the points you had laid out, I think, on your slide was that you said it was stated that over 40% of adults and family caregivers are in the US. And I just wanted to point that out because I feel like that number is actually quite small. Would you agree with that? And do you think that it's because Or at least in my mind, it's because maybe some people don't recognize themselves as caregivers.
That is exactly, I think right on the money. I think that's why it's so important to talk about caregiver identification because, we often get asked, well, how many caregivers are there? Well, that's really hard to say, because, it's based on self-reporting. And if folks aren't kind of counting themselves, that number is always going to feel a little bit low. Obviously, we also have, some changing demographics. I think both globally, but nationally with the aging population. And so I think we're definitely going to see a big increase in that over the next a handful of years. But yeah, it seems small, and I would definitely say that, it's probably not representative of a good chunk of caregivers, and especially youth caregivers. Youth caregivers are often really not counted in the numbers. But again, you have uh, grandkids, young grandkids that are helping out, maybe not doing lots and lots of like specific things, but are still there as kind of a support. And so, we're trying to figure out better ways to let those folks see themselves in kind of the resources out there and thus identify as a caregiver.
Which feeds into exactly what I was going to talk to about you next. Talk about you next, excuse me, the resources that are out there. Because I think, as you mentioned, if you're not recognizing yourself as a caregiver, you might not realize what resources even exist. Would you
Right.
be able to speak to maybe just one or two or three resources that like caregivers may not even know exist? Because I think, especially for the MG community, I know at least, being an MG patient myself, and I don't want to put words in or out of my caregiver's mouth, but like, I don't know if my mom or my husband or my sister would necessarily, quote unquote, call themselves a caregiver, right? So, in that sense, they might not even realize the things that exist out there. So, what are some of the resources that caregivers can tap into that we may not even think of?
Yeah, so one of the resources that we get lots of calls on the help desk about is support groups, because caregivers want to be able to chat with other caregivers. They want to be able to have conversations, learn from folks that have kind of been in that experience. Perhaps, they're at a different place in their caregiving journey, and you can kind of learn from what they've experienced. Um, so support groups are a big one. Things like the caregiver help desk is another one. Um, Within kind of I think, doctor medical setting, many hospitals and kind of medical systems have social workers and have kind of, I'm, it's going to vary based on the specific resources that they have for caregivers, but there's usually something, and caregivers will not often know that those things are out there to say, okay, well, how do I, my loved one has been in the hospital. They now have this going on that we're going to have to take care of at home. What do I do? Um, and so there are supports within those systems for caregivers, but if a caregiver isn't raising their hand, letting those healthcare professionals know, it's going to be a little more challenging for caregivers to get connected to that. So those are just ones that come to mind, but you know, I think more and more patient advocacy groups are really starting to include a
Yeah.
wealth of resources for caregivers. And so that could be another place where caregivers aren't thinking like, you know, uh, the same organization that they're getting information
Right.
from their loved one they can be like, hey, do you guys have a caregiver support group too? Is there information for me in taking my loved one to the doctor, helping me know like what questions to ask? So yeah, I think once you, one of the things that's kind of cool about the self-identification piece is that it's kind of like a domino, and
Yeah.
that once you do it, it becomes a little bit easier and you start kind of knocking down a few more pieces to get you to the places that you need to go.
Yeah, that that's super helpful, which actually feeds into my next question because you spoke to how patient advocacy organizations, like for example, us at the MGFA, we serve those impacted by myasthenia gravis. And those impacted are not just patients, they are the caregivers.
Right.
And we're really trying to expand our support to include those caregivers to make sure that they're getting the support and resources and care that they need. Which again brings me to my next question. You know, I know you work with other nonprofit organizations and other different disease states. What sort of things have you seen that have been really successful, like in terms of patient advocacy organizations, other than support groups, providing support? I know that still, like for us, we have our helpline, right? And while it's the audience is typically patients, we have caregivers calling in as well. So I'm curious, just like if what sort of things do you collaborate on with other advocacy organizations to support maybe specific caregiver populations that you've seen have been like really successful? Can you think of any off the top of your head? I know I kind of put you on the spot there, but I was just
Oh,
trying to think out loud, like how we can be doing a better job in supporting our caregivers in the MG population as well.
well, I mean, it's going to look different from, I think, spot to spot. Because obviously someone who's caring for a loved one with cancer, that's a very unique experience. Someone who's caring for a loved one with Parkinson's, that's a unique experience.
Right.
Um, and so, you know, one of the things that we like to start out when we're forming these partnerships is to say, you know, tell us a little bit about what the caregivers, what you're hearing or
The
what,
experience.
yeah,
Yeah.
what some of that experience is so that we can start to fill in some of those gaps. Um, so, you know, for some, it's they want specific information and resources around, you know, how can I do some of these caregiving tasks that are really centered on those activities of daily living safely, so I'm not hurting myself and I'm not hurting my loved one. Um, you know, in a rare disease space, it's what about clinical trials? You know, what can I as a caregiver expect my loved
Yeah.
one's experience to be, and how does that, you know, what kind of support are they going to need as we're going through this? So
And speaking to that, the caregiver response, the caregiver burden when
yeah,
it comes to clinical trials in terms of having to, take people to your doctor, your loved ones to your doctor's appointments, to your follow-ups, to the actual trial, all of that we don't even that I think caregivers think about, but maybe it often gets overlooked when the priority is the patient's health.
yeah. And that's the other thing. You know, really across the board too, we try to always underscore, you know, prioritizing as a caregiver your own physical and mental health too. You know, to use kind of that old tried and true analogy of, you know, when if a plane is going down and the oxygen masks pop out, they tell you to put your mask on first before you help someone else. Um, and it's that same idea. You can't, you know, if you only have so much to give and you have to take care of yourself so that you're able to care for your loved one. And there's a lot of complex feelings that caregivers have with that. It can feel very selfish because when we're in that caregiving mode, it's like everything has to be about my loved one and I don't have the time. But at some point, you're going to reach that level of caregiver stress that's going to lead to caregiver burnout. And then you're both going to be in a pretty bad way. And so that's another thing with the, I think patient advocacy groups, they really have that down to a science with patients. But when it comes to caregivers, how can we talk to the caregivers to say, like, no, it's okay to take a break. It's okay to focus on your own health because you're going to be like, you need to be there with your loved one too. So you've got to be kind of fully charged.
Yeah, that's such an important thing to remember. And, we say it, put your health first but to actually put that into action, I think is a whole nother thing. So,
Yeah.
well, Nichole, thank you so much. This has been truly a pleasure, and a privilege to learn all about Caregiver Action Network and um, like I said, talk about something that doesn't usually get talked about, which is caregiver self-identification and what that means to the caregiver themselves as well as the community at large. So thank you so much for taking the time out of your day to present to our community. And as a reminder, we will have these up on our YouTube page. So stay tuned. That should be up shortly. A lot of our viewers, which I can imagine you probably experience too, like being a caregiver, you're probably working too. So not always have the ability to access this in real time. So we will have that posted for you on our social media pages. So thank you so much. It's been a pleasure.
Yeah, thank you. It's been wonderful. Thank you guys.
All right. Take care, everyone. Bye-bye.